Yeah, so our next study, which will be a poster presentation, is looking at a quadruplet of daratumumab RVD in patients with high-risk smoldering myeloma. So again, these are patients that are at high risk of development of multiple myeloma, and this is a different strategy than the immunotherapy trial. This is looking at a traditional quadruplet in patients with high-risk smoldering myeloma, and we've enrolled 38 patients at the time of this data cutoff, and the safety profile again seems very favorable compared to what we see in patients with newly diagnosed myeloma, which is where this regimen is commonly used. The regimen has been modified from the traditional schedule to be a bit more gentler in these asymptomatic patients, so we're giving less frequent dosing, lower doses, etc. It's a 2-year treatment program, and we're studying rates of minimal residual disease negativity at several time points in the study, and the primary endpoint is to study sustained MRD negativity with this trial. So we have some patients that have gone through the 2 years already, and then at that point we have a randomization for patients that are MRD positive to go on to either observation or 2 more years of treatment with daratumumab and lenalidomide. All the patients that are MRD negative come off study, so this is a response adaptive study looking at MRD in high-risk smoldering myeloma. And so far in this trial, we've also had 100% overall response rate, so everybody's responded to this combination. But the MRD negativity rate is deepening over time, so we've had only a handful of patients, as I mentioned, have gone through the 2 years already, and we have about a 60% MRD negativity rate at 2 years for these patients so far. But longer follow-up is necessary to see how sustained these results would be.